Hi, I'm Dr. Janakan from Athulya. In this video, I will talk about something called cancer screening, especially in the elderly population. So, in the elderly population, certain cancers are very common, like breast cancer, prostate cancer, lung cancer, kidney cancer, colorectal cancer. The risk factors for all these cancers is one is old age itself, because in old age, the cell multiplication issue can arise, causing mutation of certain cells, which causes growth of cancer cells. Other things like obesity, smoking, alcohol, all these things also can play a role. So when it comes to cancer screening, the advice given to younger adults and the elderly people is totally different. Because in elderly population, we need to individualize the treatment considering their clinical parameters, their comorbidities, and especially the life expectancy. Because the life expectancy is very important as per the international guideline. And normally, only if the life expectancy is more than 10 years, we normally do the screening test and go for the treatment. So you may ask why this is so. It's because in the process of screening, diagnosis, and treatment, there may be certain things which may harm the patient. For example, when you're doing CT scans, the radiation may cause problem to them, or when you go in to do biopsies, the pain, bleeding, infection, all these things. More importantly, the psychological stress associated with the whole process may lead to even depression. Other thing is associated illnesses. That is the reason we normally see the life expectancy and do the screening for the patient. And also the age for certain cancer matters. According to the guideline, say for example, cervical cancer in the elderly female, normally after 65 years we don't do the screening. Suppose if their pap smears and all were normal in the earlier investigations, normally do the screening for cervical cancer and prostate, colorectal cancer, lung cancer and all. Normally the limit is only till 75. So after the age of 75, we normally don't go for this kind of screening and diagnosis, because as I told, the complications of treatment like chemotherapy or sometimes even surgery, that may be very disturbing, and comparing to whatever serious illnesses the elderly people are having, and especially if their life expectancy is less, so all these can be foregone for the before said reasons.